Good evening. Thank you, Russ and Sue Bailey. Thank you both for your service over the past year and the past many years. And many thanks also to Speaker Bruce Scott and Vice Speaker Lisa Egbert for putting this meeting together. It's a privilege to address you now as president. Only the third time a practicing physician from South Carolina has had that honor. The first was Dr. James Moultrie in 1851, and the second was Dr. Randy Smoke over 20 years ago. This, then, is a rather uncommon occurrence. Let me begin by expressing my gratitude to everyone assembled in this virtual inauguration, the second in a row for the AMA as we continue in the throes of a now historic viral pandemic. So many people have supported me along the way. I cannot thank you enough. If we were in person, I'd recognize you and ask each of you to stand, but tonight I'll have to call you out virtually. First, my colleagues within the AMA itself, the officers, the trustees, administrative leaders, co-workers, and the House of Delegates. Thank you. Those at home in South Carolina who've supported me throughout my career, including my fellow physicians and co-workers at Tylen's Health, and for many years at Waccamaw Family Medicine in Georgetown County. Thank you all. My military colleagues across the nation, many of whom are still in active service. Bless all of you for everything you have done and continue to do to serve our country. You truly are my heroes and my role models. The leaders of my community and state who've taken on roles of public responsibility and who've supported the medical profession in so many ways, thank you. The innumerable patients and their families who've given me so much more than I have ever given them. They placed their lives and those of their family members, sometimes quite literally, in my hands. Their continued support of my service in organized medicine and the AMA has humbled me greatly. And the most important of my supporters, and oftentimes the most underrecognized, my amazing family. My mom, Angeline. She goes by the call sign Buntsy. She raised my brother, Randy, my sister Elizabeth, and me as an incredible single parent when my father was stricken with a fatal brain tumor at age 33. She'll be 91 years of age in 2 weeks, but she's still lively and quick to give us pointed advice. Thanks, Mom, and I love you. My 3 children, Bevan, Kathy, Scooter, and their families, and my 8 grandchildren. All of them will recall that my military and my medical duties resulted in missed graduations, missed proms, missed family gatherings, interrupted plans. We all know that does happen, though, in doctor families. I love and appreciate you all. And finally, my enabler-in-chief, who's made it possible for me to attend to those duties and supported the family in my absence, my wife and best friend of nearly 5 decades, Linda Harmon. There never will be words to express what you have meant and will always mean to me, and really to all of us. If I could be half the person you are, I'd be twice what I am now. Thank you, Linda, and I love you. You know, a couple of days from now, June 17th, will be the 246th anniversary of the Battle of Bunker Hill. That was, of course, an early engagement in the Revolutionary War for freedom from oppressive control and taxation by the British Crown and government. Among the casualties to the Continental Army in that battle was this ranking officer, Major General Joseph Warren, a 34-year-old physician. 3 months before his death, he gave a speech commemorating the Boston Massacre, in which he exhorted his countrymen to preserve and defend liberty, which he described as far dearer than life. He said, "On you depend the fortunes of America. You are to decide the important question on which rests the happiness and liberty of millions yet unborn. Act worthy of yourselves." Act worthy of yourselves. 90 years and 2 days after Bunker Hill, June the 19th, 1865, marks another crucial day in American history. On that day, just after the end of the Civil War, federal troops took control of the state of Texas and proclaimed all enslaved people there free, an important step in extending the freedom fought for in the Revolutionary War to all people. I went to high school in Texas. We recognize that date as Juneteenth. As we acknowledge these historic anniversaries this week, I ask you to join me in reflecting on the words of Dr. Joseph Warren and ask, are we acting worthy of ourselves in this moment, of future generations? This is a consequential time in American history and in the history of medicine. We too are at war against formidable adversaries. The COVID-19 pandemic has led to the deaths of millions worldwide and hundreds of thousands here at home. It's led to prolonged isolation and its effects on emotional and behavioral health, political and racial tension, and the immense battle to rid our health system and society of health disparities and racism. As we face these battles, we must remember that our actions as physicians and as leaders will have far-reaching consequences for our families, our patients, and our communities, and will affect the lives and happiness of millions yet unborn. Like many of you, I've had a roller coaster of emotions over the past 18 months. I've seen the exhaustion of working 12 to 15-hour shifts alongside my frontline colleagues. They were similarly physically, emotionally dragging. I was attending seriously ill patients who were afraid to ask, will I survive? Because they were fearful of what I might answer. I specifically remember one senior patient with whom I spoke. I was wearing a complex barrier of personal protective equipment, and I reassured her. She was on a track to recover from her COVID infection. She reached out, grabbed my hands with tears in her eyes. She said, Dr. Harmon, you're the first person to tell me that. Telling moment for me. Like you, I've seen the terrible outcomes of this devastating virus and have experienced the frustration of being unable to gather with friends, colleagues, even for crucial events in life, like weddings and funerals. Adding to this suffering, the COVID pandemic has actually revealed enormous gaps in how we care for people and communities in America. This has been demonstrated in the disproportionate impact of this pandemic on communities of color and the weaknesses of our underfunded and under-resourced public health infrastructure. During these times of struggle and heartbreak, it's important for us as physicians to remember our why. Why do we enter medicine? Why do we continue to struggle against overwhelming regulatory, administrative burdens? Why do we risk our health and that of our families during a global pandemic? I would submit that the education, the training, the years of experience, and the sacrifice we have gone through has prepared us for such a time as this. This past year and the year forward is why we, America's physicians in the AMA, are here. As Viktor Frankl, who was a Holocaust survivor, wrote, those who have a why to live can bear with almost any how. We've heard for the last decade about physician burnout, increasing dissatisfaction within our physician community. We understand why that happens, given the administrative hassles and the regulatory challenges we face, as well as a general lack of understanding and appreciation for other types of important work that doctors must do. Things like academics, research, regulators, administrators. But in the past year, we've seen a new appreciation for all of medicine. Americans realize now how much they rely on their own personal doctors and other healthcare professionals on the front lines, how much they depend on the researchers and the scientists to develop treatments and vaccines, the medical educators and the teachers who mentor and train this vital physician workforce to take care of us, other physicians in non-clinical roles who deliver the crucial healthcare resources in an emergency like the pandemic. AMA's own surveys have found that nearly 50% of doctors have experienced a kind of renewal of purpose among the tribulations of pandemic response. In a year defined by so much suffering and headache, this really is welcome news. Colleagues, this past year has been extremely challenging, and we hope the worst of the pandemic is behind us. Looking to this year ahead, we're going to need to remember our why to meet the very difficult, ongoing challenges we face in medicine. We're recovering from a pandemic, vaccinating the nation. We're removing those unnecessary obstacles to care. We're ending this nation's long drug overdose epidemic. We're improving outcomes for patients with chronic disease. We're going to make technology work for the benefit of physicians and patients. We're going to prepare future doctors to meet the needs of all people and our changing world. We're going to embed the principles of equity and racial justice within the AMA and throughout our health system. Just a few weeks ago, the AMA released a comprehensive strategic plan to guide us in our work to advance health equity and justice and to improve the quality of care for people who have too long been marginalized. Meaningful progress won't happen until we as doctors recognize how profoundly systemic racism influences the health of our patients, and until we commit to taking action within our own spheres of influence. As a family doctor in a very diverse state, I've treated people from all backgrounds and have seen inequities up close. Inequities that understand lead to distrust. A couple months back, when rounding with our inpatient physician team, I was advised that a particular patient on the third floor was a 70-year-old man with pneumonia. Really didn't say much, and he was described as difficult to communicate with. That was my handoff. Well, I went in to see him. I found an older black gentleman with the last name that was clearly local. As noted, he gave only one-word responses. Rather than continue to quiz him in the usual hospital manner about his illness and his symptoms, I sat down. I told him that I had met several and treated several folks with his surname, and I wondered where he lived and what he did for a living. He replied, "Mechanic." I asked, "What type of mechanic?" "Jet engine." Now, that's not a typical profession for Georgetown County, by the way. I told him, I have some experience with jet engines, so he opened up a bit. Turns out he'd obtained a degree in aerospace and worked on jet propulsion engines for NASA at Langley Air Force Base, and I'd been assigned there for 3 years. He was quite literally a rocket scientist. From there, we'd established a bond. I was able to understand him and address his health care needs with a much more meaningful conversation. We provide better care when we treat the patient and not just the disease, and when we endeavor to overcome racial stereotypes in all our interactions. Our equity plan, just like our other strategic goals, is ambitious, far-reaching, but as individual physicians and as the nation's largest association of physicians, we are uniquely gifted with the intellectual, physical, emotional skills to respond to each of these challenges. When we invest years of our lives and ask our families to sacrifice, let's remember it's not about us, but rather about those gifts and the talents we possess to care for humanity. We don't have to be on the AMA Board of Trustees or elected to a position to lead. We lead just by being doctors every day, every category: researcher, administrator, regulator, teacher, bedside clinician, advocate. The AMA can meet the healthcare challenges of the moment because our members are physicians acting worthy of themselves every day, in every venue, and in the process, we're moving medicine forward and positively affected the lives of generations yet unborn. Just a couple of months ago, Linda and I were at a softball game watching our granddaughters play. We're wearing our masks because it was before we had some relaxation and restrictions, and a woman from the opposing stands came up with her mask on too, carrying a toddler in her arms. She approached somewhat slowly and looked at me and said, "Aren't you Dr. Harmon?" I looked at her and I said, "Yes." She said, "You won't recognize me, but this is my grandbaby here, and her mother's over there coaching first base. You saved her mother's life when she was born, and they are both here today, with me today, because of those actions. Thank you, Dr. Harmon, for being a doctor." Patient stories like this remind me of my why. They lift me up when I'm down. They give me the energy and the enthusiasm to work on this very ambitious agenda and to sustain me as a servant of the medical profession. So today I ask you, wherever you may find yourselves in this field, caring for patients, doing the work of advocacy, of education, of research, or being a supportive family member to the physician you care about, remember your why and pledge with me as Dr. and Major General Joseph Warren said over 2 centuries ago, act worthy of ourselves and our calling. Thank you.